Good day, I am Dr. Uchechi Nodem, a participant of the massive open online course on cleft lip and palate. It's been a great experience thus far. This oral presentation is focused on the challenges faced by the cleft population in my country and possible solutions to these problems. I'm a Nigerian. Nigeria is a developing country. We're classified as a low and middle income country based on our gross national income. The National Nigerian Bureau of Statistics reported that 45% of our population live in poverty. However, the World Bank income poverty threshold of $3.2 per day states that 71% of Nigerians live in poverty. The orofacial cleft prevalence presently is 0.5 in 1,000 births. And this great population gets to face a lot of challenges, some of which I would clearly state. 1. The inequitable distribution of healthcare. Only 43% of our population have access to healthcare, and 70% of the available healthcare facilities are located in urban areas, in which only 45% of the population of the country live. So 55% of the country's population live with very limited healthcare. There are only 59 tertiary hospitals, and it's only in tertiary hospitals that cleft managing teams are found, and not even all. So the cleft population have very limited access to healthcare. Also, poverty is a challenge. With poverty comes poor nutrition, unhygienic living, limited access to information, so they are unaware that this condition is not a curse or any other cultural fallacy that they believe in, and also financial constraints, so they are unable to afford care. Thirdly, a challenge that they face are the availability of healthcare providers. The healthcare team are sparsely spread in this country. They are very few, especially the non-surgical aspects of this team. The psychologists, social workers, speech therapists, orthodontists are so very sparsely spread, and those available, most of them are not even involved in the cleft management because it seems to be a lot of work, and most of them are just not motivated enough to participate. So a few solutions I would like to propose are to mitigate these current challenges and optimize care will be: 1. To increase the government participation in the cleft management. If the government would participate, we would be able to have extensive population outreaches and education, so people are more aware of the condition and the fact that it is treatable. With government support, they could provide subsidy to the treatment, so it wouldn't be a great financial burden to the relatives. And also, if another solution would be infrastructural support to create and establish more healthcare facilities in which cleft centers could be sited. Establishing remote access medicine, in which telemedicine could be used to diagnose these patients and manage these patients, so they only get to have access with to the specialist when a surgery is needed, physical examination, or anything that requires physical access to specialists, so more people can be reached at even the grassroots. Lastly, a solution I would like to propose is to train more people. There are more people that are interested in participating in cleft management but are unable to help because they are not trained. So training more and more people in the surgical and non-surgical aspects of management would help mitigate the present burden, reduce the burden greatly. In conclusion, orofacial clefts are the commonest orofacial congenital anomaly, and it is important to focus country's resources in the management of these people. I also want to thank the Smile Train for greatly impacting our country, particularly thus far, in mitigating the burden of this disease. Thank you very much.